Hello, my name is Alessandro Laviano from Sapienza University in Rome, and I would like to thank ESPEN, the ONCA campaign, MNI, for organizing these session in order to discuss with you the importance of nutritional care in the future of cancer, of the patients with cancer. The topic which has been assigned to me is to highlight the importance of nutrition, why nutrition could really be a game changer. Before starting, it's important for me to disclose my potential conflict of interest, which are summarized in these slides. And in order to attract more attention from your side, I would like to start with a very provocative statement, because we know that every year we have more than approximately 20 million new cases of cancer all over the world. We have approximately 10 million deaths all over the world. We know that in the majority of countries all over the world, cancer is the first ranking cause of premature mortality. But nevertheless, from the clinical point of view, cancer can be defined as a rare disease. Why I'm saying that? Of course, because we well know that the heterogeneity, the molecular heterogeneity of cancer cells is quite high. And these characteristics of cancer cells have been recently highlighted in a very nice paper published in Nature. The authors were actually looking at breast tumors, and they were able to show that the clone which started a breast tumor is not actually the same clone which will be during expansion, which means that every single day the cancer cells do evolve to better adapt to the environment, to the microenvironment across the tumor, and which makes, of course, a treatment for these tumors much more complicated. But we know this very well, and we also know that we have a number of strategies to address the molecular features of cancer cells. You know better than me that the care of patients with cancer is based on two major pillars. One is the so-called disease-modifying therapies, which aim at actually improving survival. And they are able to adapt the treatment to the molecular needs, the molecular features of cancer cells. And we therefore have chemotherapy, radiotherapy, immune therapy, target therapy, of course, surgery. And we know that these treatments are extremely effective in addressing the molecular needs of the patients. But in the real world, how do they perform? Let's look at some epidemiological data. These are recent data, and the mortality data comes from the US. And you see that over the last 30 years, there has been approximately 3 million cancer deaths, which have been averted because of the development in research and in the development of new drugs, which is a fantastic achievement, of course. But please note that the slope of the progression of cancer death, of yearly annual cancer death, is only reduced. It is not being reverted, which means that every single year we have more cancer death than the previous year. The other frightening results is on the right-hand side of the slide, in which it has been clearly shown by Kovic and other collaborators that based on the available clinical trials of new drugs, there is no correlation between improved survival and also improved quality of life, which means that not necessarily by increasing survival with new drugs, we can also improve the quality of life of patients with cancer. Now, why is this happening? Why there is this kind of discrepancy between survival and quality of life? Maybe because in clinical practice, we frequently overlook or completely forget the importance of the other major pillar of anti-cancer treatment, which is palliative care, which is associated with the use of nutrition, pain control, physical activity, and social support. We know that palliative care has as an aim, quality of life of the patient, but we know also that many patients with cancer do prefer a better quality of life rather than bigger quantity of life. Now things are changing. The good news is that things are changing because oncologists themselves do recognize the importance of personalized treatment, not only on the molecular characteristic of cancer cells, but also on the clinical features of patients with cancer. And by the way, it sounds quite weird that we now call personalized therapy drugs or treatment or therapies which actually are adapted to the characteristics of the tumor and not to the characteristic of the person. Nevertheless, this is a recent editorial which has been published in JAMA Oncology, highlighting that it is extremely important to enhance the efficacy of anti-cancer treatment by also considering the so-called biological age of cancer patients. And it is very impressive that in this table, oncologists do actually review some biomarkers for biological age. And you see that in the clinical indices, some of them are already well known in the clinical nutrition arena, like frailty indices, geriatric assessments, and more importantly, you see sarcopenia. So for oncologists now, it becomes very important to also address the nutritional issues of a patient with cancer, because by using this, you can better adapt the treatment, and more importantly, by treating, preventing, improving biological age and therefore nutritional status, you can also increase the efficacy of anti-cancer treatment. And this has been shown in many, many studies. This is just one of the most recent secondary analysis of a prospective randomized trial done in Swiss hospitals, and compares approximately 500 patients with cancer and hospitalized with at risk of malnutrition. Half of them were actually controlled and half of them were receiving early intervention. And you see nicely that only those who received an early intervention to prevent and treat malnutrition do have an improvement in the decline on the functional status, and also an improvement in quality of life. But not only that, you see very nicely here that by combining anti-cancer treatment and nutritional support, you also have a significant improvement in survival only for the patient who were receiving a nutritional intervention, highlighting what is already known since many years, that the best treatment for cancer patients is really when you combine supportive care with disease-modifying therapy. And you can achieve these results in a very, very simple way. You can improve survival, you can improve quality of life by slightly increasing, for example, nutritional intake. We were doing this kind of calculation, and we saw that if you can meet the minimal intake, caloric intake, which ESPEN guidelines suggest about 20 kilocalories per kilo per day, you see nicely that you can have the improvement in survival and quality of life. Also, by improving from 0.6 to 0.8 grams per kilogram per day, the protein intake, you have these fantastic results. Now, why is it so important, malnutrition and nutritional care in cancer patients? Because probably malnutrition has a negative role on the treatment, on the efficacy of anti-cancer treatments, because either increases toxicity related to treatments, but also because malnutrition appears to accelerate drug catabolism and therefore reducing their efficacy. This has been suggested by the number of studies, particularly addressing the reduction in efficacy when using immune therapy. And you see nicely from this study that the rate of albumin change during the trial actually was the best predictor for a poor efficacy of immune therapy in patients with cancer. So actually, what we have to do with these patients? Well, we have to implement all over the world the international guidelines. ESPEN issued guidelines in 2017 and has been renewed in 2021. And more importantly, now we have also a strong, important medical oncology society, the European Society of Medical Oncology, which issued its own practice, clinical practice guidelines, highlighting the importance also for oncologists of a good nutritional care for patients with cancer. Now, unfortunately, we still have a lot of them, because if you look at the real clinical, the real world, you will see that unfortunately those patients who receive early nutritional management, early nutritional care are like a tree in the desert. But because of the information that we now know, and because of the strong clinical data that we have now know, we can state with great confidence that actually nutritional care is for all patients with cancer. And thank you very much for your attention.